treat an extension lesion of the spine, we've already done the assessment, so what we did was we saw that our thumb went up, and in this case we'll choose this one here, where it went up on the left L4. So it went up on the left, my thumb went up on the left, but when I got the murder to extend backwards on it, it stayed level. So it's an extension lesion, side bent and rotated on the right. Here's the lesion here, on the opposite side from what I've marked. And the reason that I've marked the side that my thumb went up rather than where the lesion is because I want to put my thumb on that dot. And that leaves my right hand free as the working hand, and it's going to be 3 pushes. And what I'm going to do is I'm going to take it into tissue tension. So we've got an extension lesion, side bent and rotated right. So it doesn't want to be flexed, and it doesn't want to be side bent left or rotated left. So that's what I'm going to do to put it into tissue tension. So the first thing and the most important thing is to get it onto the right spinal segment, and that's what I do with the flexion. So I'm going to take it down to the point where I can feel the tissue coming under my thumb, which is there. So you can see I go very slowly into it. If I go shooting off, I'll go past it. So that's me at L4. So that's the flexion element. The next thing I'm going to do is side bent it left, and that's it coming under my thumb there, and then I'm going to rotate it left. So it's 3 pushes. Sometimes when it's low down as this, it's easier to pull the opposite shoulder, but it is effectively a push on this right shoulder. So that's pushed into flexion, pushed into side bending, and pushed it into rotation. I then put my hand about there, and I ask Murder to push back into my hand. Not too hard, because otherwise I'll start using his legs rather than his back. And I'm using those muscles down L4 on the right hand side. And I'd stay there until I could feel the fizz stopping. And then we'll bring it back up, and I'd reassess it to make sure that that's been corrected, and I should see my thumbs level. You do the same all the way up this thoracic area, and as you go up, all that happens is your hand that they're pushing against goes higher up. So for instance, let's suppose there was one here. So at this point here, again we're saying it's an extension lesion and it's side bent and rotated right. So what I would do is I would just take Murder down to the point where I can feel it under my thumb, so it's not anything like as much flexion this time. We would side bend and rotate. And here, I now want my hand here to push back. So you see it's the same kind of diagonal position where I've put the hand to push back into. And again, I would keep that on until the fizz stopped. If it's upper thoracics, then we'll keep to the same side. So let's suppose we've got one here, extended, side bent and rotated right at this level here, around about the C3, C4 area. And where I need them to push is about here. So the way we do it this time, again, we flex it to the point where I can feel it under my thumb. We side bend and we rotate. And this time I'm going to use my forearm against the shoulder and the head and ask them to push evenly with their head and shoulders into my forearm. And again, we just hold that until the fizz stopped. And finally, for a cervical one, let's suppose this one here around about C5, then again put my thumb on the dot, again flex to the point of tension. We've still got the problem on the right hand side, side bend and rotate, and this time it's the head that we use as the lever. So that's an extension lesion at 4 different points within the spine. And they're all side bent and rotated right, the examples I've used.